A show about what matters to your health here in Worcester and Central Massachusetts. Our show is a collaborative effort of the Worcester District Medical Society and WCCA TV, channel 194, right here in Worcester. My name is Jay Broadhurst. I'm a family doctor here in Worcester, and I'm your host for this show. And today we're focusing on the YMCA and some of the programs that it is offering for the health and well-being of our community, not only in Worcester, but extending into the Central Massachusetts area as well. I'm joined by three guests. To my immediate right is Brenda Jenkins. She is a community health coordinator, and she oversees the Live Strong program, the Enhanced Fitness program, and a number of senior programs at the YMCA. To her right, in the middle, is Keith Tatum. He's a survivor of cancer for many years, and he's part of the Live Strong family at the YMCA Central Branch here in Worcester. And then Matthew Evans is a senior program director. He oversees the entire wellness and membership departments at the YMCA. And I want to say welcome to Brenda and to Keith and to Matthew. Thank you for coming today to share some of the information about the Y and what it's doing. Matthew, I'm going to ask you to start, and I wonder if you could tell us a little bit about this Live Strong program that the YMCA has.
So first, thank you for having us.
Oh, pleasure. Thanks so much.
The Live Strong program is a program that we like to really kind of hang our hat on at the YMCA. It's a program that's based off of evidence, so it's an evidence-based program that lasts for 12 weeks. Through that 12 weeks, we have the cancer survivor as well as the members of the family or a caregiver join us as a family, so they get a free family membership. And through that program, we give them support not only for their surviving of cancer, but also support through other individuals who have also survived cancer. So it's hard to talk about cancer with people who never dealt with cancer before, but it's really easy to open up with people who have cancer because they understand where you're coming from. So we use that platform to make a welcoming environment. And we also do things such as we try to build them up stronger, because cancer can take a toll on your body physically.
Absolutely. Yeah.
But the biggest part is the cancer survivor piece, and the support is to be there. And we actually have individuals such as Keith who end up volunteering for us, but they also form their own little groups together. So now they're forming infinity groups.
One of the things that I've noticed as a primary care physician is that if I get a report that suggests that somebody might have cancer, and you have that first conversation, it's very common that once you say that word out loud, cancer, all of a sudden that the person I'm caring for may not hear anything more. True. And to have a place where they feel safe and can open up and can hear others who have survived share their stories, that's huge.
It's a great thing, because now not only do we get the survivor, but you also get their caretakers, because the caretakers play a really big role in the process of surviving and now living as a survivor of cancer.
Brenda, I was going to say, as a community-based and outreach kind of person, how does this program work from the perspective of how do people find out about it?
Well, many ways. I usually actually use my network that I have in the community with some of the tables that I either are sitting at, or some of the work that I do in the community. We have a lot of community events. We look at some of the faith-based organizations as well. We do some street outreach because we have a lot of populations that may not access, community health centers, and may have diagnosis but not understanding the process of immediate treatment. So we talk about how do we reach out to them in a way where in layman terms, where they would understand it, and the importance of receiving some support by coming through the Live Strong program, and not thinking that it's required to give a lot of information, because we have a lot of different ethnic groups out there, and then we have an influx of breast cancer, particularly in Latino and African American women and African women. And so, where there's this whole immigrant issue going on, and it plays a role in people coming in and getting services, and it really does. And so because of the fear, never mind of the word cancer, but the fear of other things that prevent them from getting good quality health or treatment and
Right.
support from programs like Livestrong.
And it sounds to me as if it's particularly important to be sensitive to those cultural and ethnic differences that may have to do with, what information do you actually offer to an individual? How is the family going to be involved? Sometimes, maybe grandmother, you're not supposed to say the cancer word, or so. You have, through yourself and others that you work with, expertise to be able to kind of deal in a sensitive way with all of these issues.
We do. And so I usually do not just only the outreach and looking for that, participant to come in to take advantage of the services, but also I do the intake of the program as well. So I'm asking those pertinent questions that I need to talk about the kind of health they're currently in and what they're going to be going through, and talk about where they're at in their treatment. I know a lot of times survivors don't like using the word survivors, so sometimes we'll use thriver, the word thrive, because
Right.
it changes the mentality
Yep.
of the word, the stigma of that word of survivorship. And it helps and makes them comfortable where they're able to give me information. But I also want to share that we have, I know for Central Branch YMCA Livestrong program, I've had several African women that have come over specifically into this country, to an asylum to get services that we service through our Livestrong program, and have been actually thriving, once they go through, because they don't have the same quality of services in their country that we have over here. And so I just wanted to share that information. That's important. It was.
That's becoming just recently a tough issue, because the ability of people who may not have legal documentation to stay in the United States to get in essential care for complicated disease problems, and cancer would be one of them, apparently that's now potentially being threatened. So it's another reason why people may have an extra burden to bear along with the diagnosis.
It is. It is, Dr. Broadhurst. And I think the other thing, too, about what's good about Livestrong, and, Matthew Oscar Evans said in the beginning that, you have to become like a family.
Yep.
They build that unification, because I think a lot of times that there is still that stigma of the word cancer. It's almost like for some people it's a death sentence, particularly if you've never had that kind of diagnosis. And people, the medical institution don't always prepare people with that word.
Yep.
And it doesn't mean a death sentence
Right.
at all. I mean, we have a thriver right beside me.
Well, I was going to say, Mr. Tatum, you're kind enough to come. I know you're now, as I understand from Mr. Evans, actually a volunteer and part of the Livestrong program, but you started out coming in, I guess, to the program as a participant. And I wonder if you could kind of share some of your story with our listeners of what you were facing and how coming into this program made a difference in your life.
Well, first of all, the diagnosis, as Brenda said, is the hardest part. I went to see my doctor. I went for a physical because I felt like I had a cold. So he ordered a bunch of tests for.
They always do.
Yeah, a whole bunch of tests, CAT scans, X-rays, urine analysis, and things like that, to find out what exactly was going on. So when my blood work came back, they seen that there was urine in my blood. I'm sorry.
There's blood in the urine
The blood
sample.
in
Wow.
the urine.
Yeah.
And that's not something that was they could tell what it was, but I didn't. So she immediately, I'm sorry, I said he. She immediately made me an appointment with a urologist,
Right.
and I didn't know what a urologist was.
Exactly. So,
And so the appointment was like 2 days after she found the urine, and they and when I got to his office, I read the door, and it was hematologist and urologist. I said, wait a minute, those are cancer doctors.
yeah.
So I entered the office, they call my name, and he tells me that he's got to do some further blood work on me because it was seen on my lungs, a black spot was seen on my lungs. One was a cloudy spot, and one was a solid dark spot. And before they diagnosed anything, they wanted to go further in their diagnosis.
Right.
So I went and I had the test done. They did a rapid diagnosis, and he came back and he told me, he says, what we found in your lungs was 2 spots. He said one was a cloudy spot. Second was a solid white, dark spot, black spot. And we find that it is not pneumonia,
Yeah.
which they thought I had pneumonia.
Right.
And I said, well, what was it? He says, you have stage 3 lung cancer. And as Brenda said, you're numb. First I asked him, I said, what do you mean stage 3? He said, you have stage 3 lung cancer.
Right.
I said, but I don't have no signs. I don't hurt anywhere.
Exactly.
Except I felt like I had a cold. My body was
Right.
aching from the cold.
Right.
And then he told me he was going to set up a program. I was in chemotherapy treatment within 2 days after my diagnosis. I was diagnosed with the heaviest form of chemotherapy there is, and I was on a very lengthy time because my cancer was so advanced.
Right.
So I took the program. The program was 21 weeks of chemotherapy, and then following that, I had 10 weeks of radiation.
And I think there's usually some pretty severe side effects
Yes, there
from
are
that. So
side-
it's a tough road.
Yeah, it's a tough road.
Now, at that point, did you know anything about the Livestrong program or the YMCA
No,
to support you?
no.
So how did you find the Y to help you with?
Well, I was a member of the Y before I was diagnosed.
I see. All right. So you're already a part of the family.
Yes, exactly.
All right. Good.
And so they put me on a treatment plan,
Right.
and my health diminished. I lost maybe, I think, about 65 pounds.
Yep.
I lost my appetite. I lost my ability to walk, and I ended up in a nursing home for, let me see, I think I was there for 6 months.
Wow.
Wow.
5 weeks after I got out the hospital, because after I was diagnosed, I had a seizure, and the seizure, it just took me out.
Yeah.
And then I had another seizure at the Y,
Right.
after I got out of treatment, because I came out too soon.
I see.
You know, I was just trying to act like I'm not sick.
So you're dealing not only with the cancer, but also some complications
Many,
as well.
many complications.
Right.
Many complications.
Right.
No appetite, sleepy, bone pain.
Yep.
Chemotherapy gives you severe bone pain, and it usually comes 5 to 6 days after your treatment.
Yeah.
And that's what happens with your ability to walk.
Right.
You're so sore and your body hurts,
Yeah.
can't stand on them.
Just can't go.
No, okay.
So how did you find out about this Livestrong program? When did that become part of
Well, actually,
your
I
support?
met Robert. Robert is the one who told me about it.
Oh,
Mindfulness.
Robert Harrison.
Robert Harrison.
Right.
He came from mindfulness and did meditation.
Wonderful.
And then I did a couple yoga class because he had a little assistant that came in. We did yoga, and we discussed it, and I joined the program.
Isn't that something? Let me just take a moment and say to our visitors that you're listening to Health Matters. At this show, we are talking about the YMCA and some of the health programs that they have for our community. The one we're focusing on is called Live Strong. It is for cancer, people who have had a diagnosis of cancer and are thriving with that diagnosis. And we're learning more about how this program works and how it's available in our community. Brenda Jenkins and Keith Tatum and Matthew Evans are my guests. You're a volunteer.
I'm a volunteer there.
So tell me a little bit about how the program actually works. And actually, you can do that, Mr. Tatum or Mr. Evans or
We can.
Ms. Jenkins?
I can
jump in.
start.
Yeah.
You know how the program works. As I said before, one of the things for a participant to come into Live Strong program, it's a 12-week program that we offer to families and their family loved ones.
I went twice.
And
I
it's
went to it twice.
we offer a 90-day session, which consists of physical, the mental, spiritual piece of it.
Yes.
We also have the Live Strong coaches, which they go through a specialized training through the YMCA USA.
So coaches?
Yes, we have YMCA, we have called Live Strong coaches that are specifically trained in working with our cancer thrivers. And part of their the requirement would be to do a pre and post assessment.
Yep.
So they will be testing their strength, their cardiovascular, their ability to.
So this is a more personal
Right.
kind of connection.
Yes.
It's not just a group that gets
No.
together. You've got a coach who
yes.
you get to know and who gets to know you.
Yes.
One-on-one.
One-on-one,
Yes.
and they can do that individual assessment
Right.
of your physical health and your mental health and spiritual health.
Right.
And help
Right.
guide
because,
you.
Well, I think what's good about the assessment, because it gauges us based upon how to determine what type of physical activity that
Right.
that participant do.
Right.
As Keith said, they come with a lot of complications, a
Right.
lot of neuropathy. Those that diagnosed with breast cancer, a lot of lymph nodes that may have to be moved from the upper
Right.
chest.
And that can
Yes.
affect your arm and stuff.
Absolutely. So we have to design,
Right.
create functional movement based on how building that internal strength for those participants to get back in. So they will not be able to go into a YMCA regular program. It would have
Right.
to be designed specifically for Live Strong participants. If you want to add to that, Keith. Matthew.
And as a patient, a survivor,
Right.
you're not able to do. You're able to do minimum things.
Yeah.
Anything. And oh my goodness, it's hard to get back into the swing of things.
Yep.
It takes a lot of motivation to you never ever feel like yourself once you have cancer. I like the old Keith. I don't even know him anymore.
Well,
I have
Right.
I have survived cancer for quite a long time, almost 11 years.
right.
But
you're-
my body, I feel it every morning.
Right. But you're a new Keith.
Yes,
and
I'm a new
You're
Keith.
living
And I'm coping
with this thing.
Yes,
Plus, you had family who were able to come,
I had a
with
good
you?
support system. And
That's
still,
terrific.
I still do.
and they could be involved with the Live Strong program
Yes.
too.
Mm-hmm.
That's exciting.
Yes.
That really is.
And they were with me through all my treatments. Every day there was a brother or a sister.
Yeah,
or a
is that
cousin.
right?
Oh, yeah. They bought food, and then,
Yeah?
of course, the Cancer Center provides all kind of goodies. And,
Right.
of course, I didn't eat any of them. But that's how I lost all the weight.
Right.
You don't have much of an appetite now.
So one of the things, Mr. Evans, I'm interested in is, I'm a family doctor, and I know about the YMCA, obviously. I didn't, I'm sad to say, know about this Live Strong program. So how can people like me, and I would hope that the cancer specialists would know about this kind of a program, but I think it would be nice for primary care physicians to know about it. So what role does the doctor have in the Live Strong program?
I'd say the biggest role is awareness, but unfortunately, not many doctors are aware of the program.
Right.
So that's kind of put back on the Y to promote its resources, to promote the programs that we have.
And thank you for coming on the show.
Oh, well, thank
to
you for
help
having
out
us
with that.
again. And
Right.
it's the way that we approach and the way that we voice these programs. And the program can be promoted many or a multitude of ways. It can be promoted by the flyers or the handouts that we have sitting inside of St. Vincent's or in UMass,
Yep.
or it can be a part of the fundraising programs that we have in the lobby of St. Vincent, or in the Mission in Motion, which is a huge fundraiser that we do across the association, which is built around spinning or indoor spinning,
Yep.
which is kind of the link to Real Live Strong and Lance Armstrong and the
Sure.
bikes and whatnot.
Right.
But there's also the word of mouth. The word of mouth is really key, because that's when you can really get the personal touch and kind of pull on some heartstrings and say, well, this program helped me. Maybe it'll help you as well.
Right.
As far as us in doing outreach, we're always trying to tell someone about this program, but sometimes it's difficult to tell someone who has just been diagnosed with cancer because of the
Absolutely.
depression that may set in.
And it sounds like it would be nice if the physician knew about the program and could give people both awareness and encouragement to participate. But it sounds like they don't need a referral. This isn't something that goes to third party. You don't have to worry about your health insurance or anything. And I think, if I'm right, Mr. Tatum, you said that, or maybe it was Ms. Jenkins, that if you come into this program, the membership
It is a free family
is
membership.
free.
Yes. So we try to take away all the barriers of not being able to get inside the doors or not being able to be a part of a program by offering that free membership. And if we have to extend that membership because of a hardship, then we will absolutely extend that membership. So there's nothing in the way of saying you can't be here.
Isn't that great? And that means not only that group kind of support and the coach that you talked about, but now the facilities of the Y, whether it's, the exercise areas or the yoga, I think you mentioned, or swimming.
Yep,
I mean,
we've been in
all
all
of those
places.
facilities are now open to you, although you did say that you might have to modify some of the programs depending upon the limitations that may be going along with either the disease or the treatment.
Right, and so and to really talk about how the medical doctors can support us. So that's why, one, thank you again, Dr. Broadhurst, for having us on this show, because it's very important. I think the other thing is asking, Worcester District Medical Society that we be able to disseminate, all our information to that network of medical providers so that they will have access for their patients to come into our YMCA. I also want to share that we do have Live Strong Association-wide, but we're definitely in different demographic and geographical areas, So, we do have a fundamental uniform of how we do the program, but we definitely customize according to the demographics that we work with in our area. We're urban-wide, so we may be a smaller program and stuff, but it provides the same quality of services that is needed across the association.
I see.
It's year long as well.
And it's all year round, absolutely.
I see.
And I just wanted to share, Keith, brought up a great thing. Mindfulness, as you know, it's big today.
Yeah.
It has helped a lot of cancer thrivers. Really changing the mindset, really showing how to relax, the body and the blood pressure, and it's really had the ability for them to really go and really share some of those coping mechanisms with their families as well, too.
That's great.
And even some of the icebreakers that we do, because we're not just the physical component, there's a support piece that comes around a round table where we do icebreakers, so that we'll be able to build the relationships in those groups.
And that support that comes with it, the strength, both within yourself, but the physical self as
Yes.
well. Now, there are a number of other programs, and we're coming toward the end of the program, but
Okay.
there's one that you mentioned to me called Enhanced Fitness, and I wonder if, I'm not sure if it's Mr. Evans who wants to take that
Oscar.
on?
I can start that one.
Okay.
So Enhanced Fitness is another evidence-based program given to us by YUSA. It's also a grant-funded program by Central Mass Agency on Aging. They are helping us kind of spread the word and also funding the program so they can reach more individuals.
So this is for older people
Absolutely.
like me. Is that what you're saying?
Yes.
How old are you again?
I'm north of 65. I'm
Yeah,
just saying.
it's for the active older adult.
Yes, it's for, like you said, active older adults, and it is a program in itself. So I believe that you have to be in the program. You have to be a member of the YMCA, and it comes with activities which encompass fitness, social awareness. Other education as far as nutrition come along in there as
nice.
well.
Yep.
And then there's the socialization portion of it as far as getting active older adults together, maybe going on certain field trips, but it encompasses the entire person, not just the physical aspect of it.
And that's a program that just keeps going? Because you mentioned the Livestrong program, I think, was a defined, was it 12-week
weeks.
program, but enhanced fitness is
Very
something that...
Very similar.
So very similar. Right now, we're going to be piloting the program for the month of September to kick off the first day or the first session of the program in October, and that
great.
program will last, I believe, it's 12 weeks.
12 weeks.
I
So
see.
12 weeks, and we're going to try and run 3 through the fiscal year. So 3 from the time of October 1 to September 30th.
Isn't that great?
So it's for our senior population.
Absolutely. And again, with the sensitivity that particularly the Central Branch has
Yes.
to a variety of populations, individuals who come from different backgrounds, addressing the issue of isolation that often affects older
Yes.
folks, and having people come together can be huge, not just for their, physical health, but for their mental health and social health. And you
Absolutely.
said there's nutrition pieces as well.
Education pieces, there's, like I said, the field trips, there's the education will go from, I think we have one on nutrition, one on the social aspect of it, definitely
Right.
the fitness aspect, and then there's kind of everyday living things, like there's things on financial awareness. So
Right.
there's certain aspects that we really want to touch on.
Excellent.
Drugs.
Well, thank you all for joining me. I have Brenda Jenkins and Keith Tatum and Matthew Evans, all from the YMCA. My name is Jay Broadhurst. I've been your host this evening. Thank you so much for joining us. I want to thank Frank Rocco, our engineer, and Melissa Boucher, who's our camera operator. And I hope you'll join us again next time on Health Matters.
That's good.